I was desperate to have a psychiatrist, any psychiatrist, whether they're next to me or on a television. So when they spoke about telemedicine, I was quite chuffed.
Thato is the only clinical psychologist at Bongani Hospital in Welkom. She used to depend on intermittent in-person visits from a psychiatrist to help patients with severe mental health issues. But a new telemedicine project of the MTN Foundation is bringing help closer.
How it was running before, the psychiatrist would physically come from Bloemfontein about 3 Tuesdays in a month and see the patients.
The basic idea is to take the services to the patients, where the patients don't have access to specialist care that they would have waited 3 to 6 months before they can get to a clinic.
Instead of the doctor or the patient traveling, you do it using Skype. In that way, there is interaction, and especially for a psychology, psychiatry clinic.
Thato now uses a computer to work each week with a psychiatrist 160 kilometers away. The MTN Foundation has set up 76 telemedicine stations in 6 provinces to help specialist doctors share their time and skills. And 12 regional Free State hospitals are now connected to doctors in Bloemfontein.
How it works is that I see the patients, I can assess the patient, and then I can present the patient already with a working diagnosis. It just made things that much more easier because then me and the psychiatrist can work in a multidisciplinary manner and find the appropriate medication and start appropriate therapy when need be.
Thato is the psychologist and I'm the psychiatrist. I prescribe medication for your feelings to be better, but you still need someone to assist you with the coping skills and the managing and the handling of your feelings and things like that. This is where Thato comes in.
So coming to a small town, you're alone, is a bit of a challenge. I know that on Tuesdays, I get to be with other health professionals. So the support is really fantastic because also when I see a patient and I know that this patient needs medication, or if I'm struggling with a diagnosis, I can get the necessary assistance.
They actually calm the patient and I think they explain to them how they are. It's like they prep the patients beforehand. That is one of the major things that contribute to the teleclinics being successful so far.
The patients love it and I love it too. At first it was a bit strange. Then you have to show them, there you are, in the TV screen, that's you. So at the end of the day, they're so grateful that they can meet a psychiatrist. It works for them because they still have the human contact. I'm here. So it works perfectly for them.
As a country, we'll never have enough doctors, especially specialists. We need to use what is core to the business because that's what the company knows best, to improve the lives of people. If this technology can assist in bridging that gap, I'm very, very happy.
If we can't get to the patients, if we're not there personally, but at least the service is still getting there.
A patient's prognosis is always better if 1, yes, they go for therapy, 2, medication. For me personally, it's the relief. There will be help and that the prognosis for the patient is much better.